So on jobhero.com under occupational health nurse resume samples, I found two resume samples that I found interesting. Um, they had an example for a nurse who has had experience for 3 years in the occupational health nurse field. They also had an example for a nurse who's been a nurse for 37 years. So the difference here, based on the resume that I found, shows the objective would be for the 3 year nurse, manage the delivery of occupational health services, applying principles of health promotion with while monitoring a safe and healthy environment in the occupational setting. And her experience shows assessing employees, regarding injuries, administering appropriate follow-ups and treatments, documenting the treatments of the workers, any claims, initiate accident investigation reports, as well as establishing and maintaining employee health records. Later on, it shows that she has experience assisting in the administration of compensation workers. She also served as someone who helps with insurances, healthcare providers, and company policies. She maintained OSHA reporting requirements and supported and assisted HR and safety department. On the other hand, we have another nurse who is trying out for occupational health nurse case management of North America here. Oversight is what she's done, and she's including workers' compensations, case management, emergency response team, office ergonomics, medical surveillance, health and wellness. So we could see that she has much more experience in different settings. Here, what she has experience in is she created initial company OH programs leading to promotion for corporate alignment and standardize of global sites. She's realized 1.6 million savings in the first year by obtaining and maintaining self-insurance for workers' compensation. She developed a plan for on-site lab collection and testing, showing savings of 100K annually, reduction of downtime and transportation. She also produced ergonomic assessment programs as well as online training for staff, which also resulted in 0 work-related claims for cumulative trauma disorders. This nurse also designed and operated on-site medical clinic and fitness center, collaborated with human resources and benefits of issues dealing with FMLA, ADA, fitness for duty, and leave of absences. So we could see the difference between a 3 year nurse, what her resume would look like, versus a nurse who's been on the job for 37 years, who already knows how to, compensate her job and save money for the job, as well as implement plans on her own. And we see the difference between that. Furthermore, the American Board for Occupational Health Nurses is authorized to certify OHNs. So you can also become a certified occupational health nurse. And these certifications are the Certified Occupational Health Nurse, and then we have the Occupational Health Nurse Specialist. What I read is that you can basically only hold one certification versus the other. The occupational health nurse, she examines and focuses on occupational health clinician practice, mainly clinician, coordination, advisor, case manager, and must hold an active RN license and have 3,000 hours of occupational health in the past 5 years. They also show on the website further information of what other alternatives to this experience they have. And then the occupational health nurse specialist. The occupational health nurses specialist examination focuses on emphasis on administration in the workplace. So roles associated with anything examination wise, clinician, manager, educator, consultant, and case manager. This nurse must have an active RN license as well as 3,000 hours in the past 5 years and must hold a bachelor's degree or higher. There's plenty of information we can find online at the American Board for Occupational Health Nurses. There's also plenty of websites that my colleagues have shown here too. And so overall, there's much opportunity job wise for an occupational health nurse, and you can grow in the field. And as we can see, the 3 years versus the 37-year of experience, how much of a difference and how much of experience you can gain from this job setting. Thank you so much for listening to me.